Hello everyone, welcome back to my channel. My name is Marian. If you are new here, welcome. I have been doing these CT registry review courses and I do have a playlist that is filled with them, so feel free to check them out. If you are returning, thank you for coming back to watch my presentation. For this one, we are talking about special procedures, those type of biopsy that you will see or perform in CT. For the special procedures, we are going to talk about your myelograms, your interventional CT, where we do biopsy procedure aspiration. It can be done on the fluoro. And then you have your PET CT, you have your radiation therapy planning. You have a CT arthrogram, which is going to be used to inject contrast into the joint space. After that, we would scan them in CT. We are mainly focusing on how the joint is looking. So in this picture, you see the white area around the joint. That is the contrast. So that is a good arthrogram study. You have your CT myelogram, which is going to be performing CT images of the spine, mainly used for herniated disc, spinal canal narrowing. You have the radiologist that will inject that contrast dye into the spinal canal. So just make sure that your patient is not allergic to iodine before starting. And this is just a prep for a myelogram for the patient to follow. Most of the time, scheduling or their doctor will give them this information, but you do need to double check and make sure that they have been following this prep before you start. Also, make sure that they are not allergic to iodine. That's very important. For interventional CT, this is when we are going to be performing those biopsies, those abscess drainage, any type of radiofrequency ablation. So this is what this is for whenever you do have the patient and for a CT biopsy procedure, just check with the radiologist to see how they want you to position a patient. And then before you are done with that biopsy procedure, you do need to ask the radiologist if they need a final picture. Most of the time, they will want a final picture before the needle is removed. So just check with them before taking the patient off the table. You have your RFA, which is pretty much going to be placing a probe into a tumor. This will be done by the radiologist, but of course, will be done under CT imaging guidance, or it can be done under CT imaging guidance. So this is just a picture. You see a probe is going into the liver for a tumor. You also have your CT fluoro, which is pretty much a real-time CT imaging of different CT procedures. So when this is done, you can actually see how the needle is going in, how close or how far away it is from that tumor. One thing to know about this, it is an increased amount of radiation dose for the patient and the staff. So you want to make sure that you are using a low MA to reduce the radiation dose. Make sure that you are not using a lot of fluoro time. So minimize that fluoro time or that time that you is in the procedure. A way you can reduce patient radiation dose with CT, use a low MA, low KVP, limit the time that you are doing the fluoro procedure, use the last image hold feature. Also, make sure that you are wearing your lead apron shielding, the lead apron, the thyroid shield, your gloves, your glasses. So all of this is important to reducing that radiation dose. You also have your PET CT. If you do perform PET scans, can you put in the comment section? I know a lot of PET techs or nuclear medicine techs, they do get into cross-training CT. So that would be cool to know if you already know about PET or if you do perform them. You have radiation therapy planning. I know some radiation therapy techs that is looking to cross-train the CT because it is also used with therapy planning for the patient's treatment. So let me know in the comment if you are already in radiation therapy or if you are a nuclear medicine tech trying to cross-train or cross over into CT. Well, that is it for this presentation. This was a very short a quick presentation about biopsy procedures. So if you have any questions, feel free to put it in the comment section and just stay tuned for the next lesson. Thank you all for coming back and thank you all for joining me and for watching.